to Beatrice Weekly Health Tips. Hello, I'm going to talk today about dental issues. Sorry if I started to speak French. um, Dental issues. So, what do I mean by that? Well, dentists are very useful kind of people because when you have a toothache and you have a hole, it needs to be fixed. It needs to be replaced with some kind of material. Since World War II, dentists have put heavy metals in people's mouths. I had a podcast last week about that. Heavy metals as in mercury, aluminum, cadmium, lead, etc. And they thought that they were doing the best job they could. And they were using these minerals, these heavy metals, because they're hard, so they would last for a long time. The problem with that is that these minerals, these heavy metals, leach out of the teeth or the amalgams. And by leaching out, they're going to poison your body in different places, as I explained last week. Brain, mainly, organ, hormonal system. They go into the fat, they can go into bone tissue, they can go into your liver, etc. So we have a lot of issues nowadays as practitioners because of the heavy metals that people have been polluted with. So that's one point. There is another problem with dental work, which is root canals. Root canals are when your tooth is not able to be saved and the dentist is going to kill the nerve and remove it, and you have a hole inside of the pulp of the tooth, which is filled with some kind of material that is supposed to really fill up the little tiny microscopic tubules that are inside the tooth. And in theory, that's what happens, except that we have known and noticed, not me because I'm not a dentist, but dentists, holistic dentists, have known that the fillings that they use to fill out these microtubules are not always as efficient as they should be. And by not filling out this inside of the tooth, then the tooth tried to develop infection. Because when you have a root canal, you basically have a dead organ. You have a dead bone in there, a dead tissue. It's not fed by the bloodstream anymore because there's no more nerve ending. So they kill the tooth, but they leave you with a dead tissue. And that's the only medical profession that does that. If you have something that is not usable in your body, usually a piece of bone or a piece of organ or a piece of tissue, it's removed. Because if you don't remove it, the body is just going to try to get rid of it. That's nature. And the best way to get rid of it is to create infection. So these microtubules are sources of microinfection. I have seen, and that has happened many times, patients who were doing all the work with me on nutrition and hormones and digestive system, etc. And then they were not getting better. They had no more amalgam fillings, but they had a root canal or two. And when they went to see a holistic dentist, that holistic dentist determined that that root canal could be problematic. You have to know that a root canal that is problematic is not going to show up on an x-ray. And this little pocket of infection is not necessarily going to show up on an x-ray. So it's really hard to determine. But holistic dentists are more aware of that, and they will look for it, and they have different different methods of testing. In any case, several of my patients had this root canal removed, and underneath was a teaspoon of pus. It was totally infected. This infection could have been going on for years, 10 years, 20 years, whatever. And the person had no symptoms, but the person's immune system, for example, was not working well. They were sick all the time, or they had autoimmune disease, or they had migraine, or they had allergies, or they had whatever. So root canal can be a source of infection, and that is often the case. And holistic dentists try to not do root canal if they can. Then you have the problem of crowns. Crowns are a cap, they're covering the tooth, usually one or two or three. And underneath, quite often, you have heavy metals that you don't see, and the dentist can't see it either. If it was done like 20 years ago, or 30 years, or 40, you can be sure that there are heavy metals. If it's more modern crown, depending on the dentist, more and more dentists are aware of the problem of heavy metals and use it less and less, so you have less chances of having heavy metals under a crown. There's no way to know until the crown is removed. I know, it's a bummer. Then there is the problem of implants. I counsel my patient, and again, I'm not a dentist, it's just my common sense. If you have to have a tooth removed and it's in the back of your mouth, I prefer that you leave it as a hole. I know the hole can create other problems, as bites, and it's going to move the other teeth, but I also believe that putting an implant is a bigger problem. If you have a tooth that was removed in your front teeth and it's in your smile, then you need to have an implant, of course. We can't live in our modern days with a hole in our smile. So these implants are made of titanium dioxide, which is a strong, strong, strong material. And the new material, sorry, not titanium dioxide, just titanium. And the new material is zirconium. Zirconium is what makes look like a diamond, a false diamond. And zirconium is even stronger than titanium. So that's what holistic dentists are now putting in when they need to make an implant. Other problem with dentistry is galvanism. Galvanism is when you have several metals in your mouth that interact with each other, and it's an electrical interaction. For example, gold and silver don't go together. They're opposite in their electrical charge. So they are creating a kind of electrical current between your tooth that is covered with gold and your tooth that is covered with silver. And that can give you all kinds of symptoms, from migraine, fatigue, to electromagnetic sensitivity. We have more and more patients now suffering from EMF, and there are many reasons for that, but one of them can be galvanism. I actually have the example of a patient of mine in France. She just had like 4 dental amalgams removed that were big and creating apparently problems. As soon as she removed that, she said that her tolerance for EMF was better. And it happened, during the week that she removed it. So this is real. The galvanism is a problem. And then we have gum problems. When your gum have a problem, it's a problem of pH and flora that is disturbed. So you can have an excess of bacteria growing and creating pockets. And of course you know that because you go to the hygienist and have your teeth cleaned up, which is a good thing. I do that too. But you have to understand that if this happens, it's because there is an imbalance in your mouth. So the imbalance can become from a disturbed pH saliva, and the disturbed pH saliva comes from a digestive problem. So you have to work on your digestion, on your gut flora, and then on the flora, the local flora of the mouth. I usually recommend people to open a probiotic capsule and let it sit under their tongue before they go to bed. You can also use CoQ10, which will help to repair gum damage and help the gum to grow again. So what to do with dental issues? We all need a dentist. I absolutely recommend to see a holistic dentist. That's the minimal thing you can do. A dentist that is still telling you that mercury fillings and heavy metal fillings are okay, it's not a dentist that you want to see. I'm sorry to say, but for me, that's a big no and no and no. So you have to see a holistic dentist. There are holistic dentists all over the country and more. There is Holistic Dentist, American Holistic Dentist Association, and many others. You can Google them and you'll see them. And then you will need to work on your digestion, because if you have teeth issues, the chances are that it's coming from digestive issues, beside the obvious, which is eating sugar, of course. And you have to work on your gut flora, as always and forever. You have to work on your gut flora, rebalance the pH of the gut flora, which will rebalance the pH of your digestion and of your mouth as well. So that's my recommendation for dental issues. It's a bigger subject than that. These podcasts are just for information only. I don't go deep on purpose. If you want to go deep, you need to read, you need to consult, you need to contact someone that knows about these issues. I wish you a wonderful week. Bye bye.